The presentation this afternoon in SDS Research 1 is Fair Balance, FDA regulation of direct-to-consumer pharmaceutical advertising. And the presenter will be Sarah Hansen. The project advisor was Professor Peter Norton.
So hi, I'm Sarah Hansen. I'm presenting my SDS thesis titled Fair Balance, FDA Regulation of Direct-to-Consumer Pharmaceutical Advertising. So starting off with just a little background, currently the United States and New Zealand are the only two countries that allow direct-to-consumer pharmaceutical advertising. So I'll be looking at why that might be, what kind of drove the changes in the 1990s in the US that allowed the United States to be one of those two countries. So direct-to-consumer pharmaceutical advertising, that's those advertisements you see on TV for Claritin, Celebrex, sorry about that, some technical difficulties here. Okay, great. All right, so looking at that, I'll talk a little about what exactly those changes look like in the 1990s. So in 1985, there's a moratorium on direct-to-consumer pharmaceutical advertising. They took 2 years off and then kind of made some changes. Advertisements had to present a fair balance of information and include a brief summary. However, that brief summary was rarely brief and not much of a summary. I guess that would be that full page of text you see on the backside of magazine articles. So there's some changes. That was hard to present on television. So instead, companies sort of skirted the boundaries of what the regulations were with these advertisements you see to the right here. An advertisement could include just a name or just some of the indications, but not the two of them together. It could say, ask your doctor about Claritin, but not provide any indication of what Claritin might be treating. So in 1995, there's some hearings held that addressed some of these concerns. Companies wanted to push a little bit further, and the FDA needed to stop companies from going too far. So in 1997, new regulations were issued that included, said that as long as the company had an adequate provision for providing the brief summary, such as a telephone number or website, then the company could provide the indications along with the product name. So I looked at kind of what participants were involved with shaping these changes. There were physicians involved, there were pharmaceutical companies, lawyers, public relations teams, kind of a whole host of people who influenced how these changes looked, as long as the FDA, one of the key players. So based on my research, I found that pharmaceutical industry interests really influenced the course of these regulations. But the FDA had to also be careful that we're staying within the legal boundaries of what they could do as they kind of changed what was allowed. At the same time, there's some physician pushback. They questioned whether this was patient empowerment or kind of emotion promotion is the term they use. So looking at that, there are hearings held in 1995, and that's something I kind of focused on in the course of my research. One of the things that came up again and again was what information looked like. Here, Franz Zingelfinger, back when advertisement could only be directed at physicians, saw that information was something that really, it needed to be considered in context. You needed more information upon gaining that first information. So that would be your physician who would provide a patient with information before these advertisements were allowed. From the industry side, they had a different perspective on information. They said that people were craving this information. They were actually asking for this as they tried to inform their medical decisions. So some kind of back and forth there on what exactly that information looked like and what exactly that would mean for these regulations. One suggested change would just include this blanket statement presented by Thomas Lahm. This would just be included on any packaging and would direct the patient to go see a physician and talk with them rather than include specific indications. So looking at that, there were the final included something like this, where a patient was directed with that adequate provision. They were directed to see a physician, or kind of there still was that gatekeeper, but it was a little bit more direct to the patient in the first step. And I guess looking directly at information ignores kind of the fact that these pharmaceutical companies are a really major market player. The lobbyists at law firms, public relation teams really have a lot of influence in the industry. Peter Seaver, though, really believed he represents kind of the pharmaceutical industry interest here. He really saw that self-regulation was something the companies were looking for. They thought that as long as they could kind of manage themselves, not push too far, then the FDA would stop from, I guess, meddling too much in their affairs. So he believed that the industry would be able to do this and would be able to stay within the bounds and not push too far. So I guess the FDA was also a player we talked about. 2 minutes. All right, great. So looking at that, they also focused on information, how much they could push. But there were constraints they had to work with: a budget, a limited enforcement staff. They were dealing with all those concerns, and some key kind of personality changes in the 1990s influenced the course of that. Michael Friedman had worked for pharmaceutical companies, replaced a previous director who was a physician, so kind of changes in players in the market and the connection the industry had there. And there was some pushback from the medical community, so it kind of looks at the question of, did the FDA find a fair balance between patient information and risk mitigation, and did the agency make an adequate provision for customer safety? So looking at that, the FDA was criticized in the past for being slow to approve products and too slow to allow them to be advertised. So kind of moving forward with new changes in the technologies, the biologics, biopharmaceuticals, and new changes in advertising techniques as things move to the internet and social media, the FDA really needs to grapple with its role as a gatekeeper and figure out how much to allow and how much kind of customers need to find on their own. So, thank you.
Thank you.